Today we're going to talk about a new product called Kaboom XERO Sticks. This definitely can be a paradigm shift in the way our profession really thinks about dry mouth and improving oral health. The goals of this presentation are to discuss the features of the product, how it improves oral health, how it solves floss's problems, why people are going to use it, and how it benefits your office. On the far left over here, we have a trademark Infinity Cut, which basically doubles as a toothpick holder for the table. Now, these flavors are actually guaranteed to last longer than the stick. It's quite often that somebody might want to put this down and return to use to it later. I think it's a great benefit that the part that's going to go in your mouth is not going to touch the tabletop. There's obviously a lot thicker circumference than the typical toothpick you guys are used to that are manufactured overseas. But that actually has two important functions. One is ease of maneuverability around the mouth, and the second is actually where we infuse compliance into the stick. We're going to talk a lot more about that later. The material is sustainably harvested, toxin-free white birchwood from the state of Maine. Our ingredients, we have zero-calorie dental-friendly sweeteners such as xylitol. Some of our products have a 15-milligram boost of caffeine and custom flavor profiles. And of course, on the right, one end is shaped to help keep the teeth clean, remove plaque, and contribute to overall oral hygiene. What makes the XERO Stick special in terms of the functional ingredient is a plant called spilanthes. And this is probably the most interesting plant that dentists have never heard about, especially because it's actually called the toothache plant. This has been used as a traditional remedy for a very wide range of sorts of oral ailments for over centuries. A lot for toothaches and really inflammation of the mouth. But it also has a very interesting side effect that it's a well-documented sialolog, which is an agent that promotes salivation. Dry mouth is probably the fastest growing problem we have in dentistry right now, largely from the increase in use in medications. It's already reported that 1 in 4 has dry mouth symptoms. But herein lies dentistry's problem. A lot of people have to lose about 50% of their salivary flow before they perceive they have dry mouth and report it as a chief complaint. But by that time, the damage is already done. Ongoing bad breath, a 3 times greater risk for cavities. And of course, all dentists know that you need saliva for effective remineralization of teeth. And if you want to talk about a very interesting and fun, inexpensive clinical study you can do in your office, it only takes about 10 minutes and $10. If you go to Amazon, you can get some pH testing strips. You wait till your staff has finished lunch or they've had their Red Bull after the morning huddle meeting, and you take their pH in their mouth. It's very often going to be below 5.5 in the demineralization zone. You put a Kaboom stick in your mouth, the XERO Sticks, and you're going to feel that tingle salivation take place. Very often in about a minute to 2 minutes, you're going to come all the way up to at least 7. But you're definitely going to get out of the demineralization zone. It's widely promoted that 6 out of the top 10 medications cause dry mouth. But that's actually a very misleading statistic because we're really not looking at the full breadth of the problem. For example, the Z-Pak, azithromycin, that doesn't cause dry mouth, but everybody that's on that is taking decongestants and they're probably taking allergy medications too. So really, when you look at really what's going on with the medications they're also taking, that actually does have an effect on dry mouth. Metformin and Synthroid, 4 and number 9 on the list, don't cause dry mouth. But hypothyroidism and diabetes certainly does. That's some of the biggest clinical implications we see every day in our office. And just for simplicity of this list, I've only taken this out about 700 million prescriptions. But if you extend this list to the top 50 drugs, and you're looking at about 3 or 4 billion yearly prescriptions, you're going to see many more of the medications that people are taking many of at the same time. For example, nobody's taken Norvasc as a first-line cardiovascular drug. They're taking many other cardiovascular drugs in that top 10 to 50 list. Another one, Soma. Soma doesn't cause dry mouth, but we take it for severe musculoskeletal pain. Anybody that's taken that is probably taking other pain medicines that cause dry mouth, or they're probably even taking anti-anxiety pills because it's stressful to have chronic pain. So when you really look at the real definition of the medications, the diseases, and the comorbid factors that are affecting this, the numbers are much closer to 100% than they are even 90. Dentists, medical professionals, and patients know there's unfortunately very few good alternatives for treating dry mouth. I found this out firsthand when I started to take some medications that were actually causing me to have dry mouth. I found that the mouth rinses that I've been recommending for my entire career were not very convenient and easy to carry around, and they didn't really last that long. And really, they weren't doing much more than water. They were providing moisture to the mouth, but they were doing nothing to promote salivation. Pilocarpine and Exovac are two drugs that do. Now, I mostly remember pilocarpine from taking my dental boards, but I've almost never seen any patients actually taking it. And I had to actually go to a pharmacist to find out why. He kind of laughed to himself and said that medication expires on their shelf every year, and no one ever comes to refill it. And we just got to look at the side effects to figure out what's going on. First of all, it's got a half-life of about 45 minutes. And because it's centrally acting drug, you get a very thick and ropey saliva that comes all at once, almost to the point of gagging. But also it causes excessive sweating and massive diarrhea to the point of dehydration of your body. It's not something that people want to take every 2 hours. Kaboom Zero Sticks, on the other hand, a very effective, convenient, and easy way to promote salivation, hydrate the mouth, reduce stickiness in the mouth, keep the pasties away, and reduce cotton mouth. Some of you might be asking, are toothpicks effective at removing plaque? A lot of the studies clearly show that they are. The study done by Starner looked at toothpick, floss, and the interdental brush and found that the toothpick and floss performed equally at removing plaque when combined with toothbrushing. Zanetta also did a study comparing the round and triangular toothpick and found that they both had an equal reduction in plaque. A lot of our problem with floss is compliance. There's been many studies out there where they've looked at specific socioeconomic groups, races, and genders, and found that the use of floss is unfortunately very low. I like this study by Dr. Segalnik. He looked at 630 people, half of which came from a hospital clinic, and half of which came from a periodontal office. So he was able to really look at all of these factors in one study at the same time. And let's look at what he found. In the periodontal office, 19% of periodontal patients were flossing daily. Now, not only is that staggeringly low, but the periodontal patient probably has insurance, probably has money, probably has education, and undoubtedly has been probably told by their dentist and hygienist 100 times how to floss and when to use it. Yet there's only 20% of them that are using it every day. The hospital clinic, single digit, very typical for those studies. Single digit floss use is very typical for that group. Don't floss at all, 42%. Again, maybe it seems kind of high, but really, if they were doing what we've been recommended for their whole lives, they wouldn't be in the periodontal office in the first place. 71% not flossing at the hospital clinic. That's the only one I got a little bit of a problem with, because if we're saying that you're using floss once a week or twice a week, it's kind of debatable if that's better than using floss at all. But the most interesting part of the study, and really I haven't found anybody else that's looked at this, is how good people floss. And he actually found 40% of people were not actually flossing correctly. They were only passing it up and down through the contact. They weren't actually wrapping it around the tooth. So not only do you have to use floss consistently, but you also have to use it correctly to get it to work. Why are people going to use Kaboom sticks? This is really two separate questions. Part of it is a social issue, and part of it is an improve oral health clinical aspect. And I've given out 1,000 of these. And I'll tell you, men and women that are around this age group of Gyllenhaal and Ryan Gosling and Twilight Boy, they don't really have a problem with toothpicks. They think the Zero Stick is like Pop Rocks in their mouth. And actually with the caffeine, that's a big thing that increases compliance. They think it's kind of nice to have a peppermint that has a little bit of caffeine that's infused into a stick. They think it's a cool and fun thing to use. A lot of the older generation that grew up with people like James Dean and Paul Newman, they've got a lot of dry mouth problems. Nothing they take works, and they're just happy to get something else that works. And this almost takes them back to a time of when people were really using toothpicks very routinely. There's this certain age group in the middle that grew up kind of with mispolite and mismanners saying it might not be good to use a toothpick. But, you know, it's really just about how you approach these patients. You have to use your talents as dentists. We don't go to a patient and say, I'm going to stab a needle into your gums, drill away your bone, and rip out an appendage out of your mouth. We got better ways of articulating it. You just got to sit them down and look them in the eye and just say, hey, Molly, have you ever had a lollipop? Yeah? Well, when this is in your mouth, it just looks like a lollipop stick. But it's a sugar-free, kind of tastes like candy. It improves your oral health. It freshens your breath. And it's really going to help with all those medications that are causing dry mouth that we're needing to do all your fillings. But there's also a lot of psychology and a lot of compliance built into this stick. One of our most basic psychological principles is called Thorndike's law of effect. And what Thorndike found is that rewarded behaviors are repeated. That's the whole reason of why we give stickers to kids when they complete chores. We're trying to reinforce behaviors that we want to see repeated. In our example, the behavior we're trying to use is using a Kaboom dental stick to clean your teeth. The reward is the instant gratification of fantastic mouth-watering flavors. Gum companies have done a lot of different studies showing that if you're chewing gum, it's going to affect the pH in your mouth, and that's going to reduce the acid and eventually promote remineralization of teeth. But they've also looked at why do people actually choose gum. On the far right-hand side, 15% of people chew gum to protect their teeth, but almost 80% of people use it to freshen their breath. So the take-home message is, if we want people to do something to protect their teeth, we have to give them the reward of fresh breath. That's what's worked before. Not only that, every bar in the middle has something to do with oral gratification in one way or another. This is an advantage that floss does not have. Oral gratification is a very powerful habit that we can piggyback upon in order to improve oral health. Perhaps our biggest improvement in oral health that we've seen in the history of our profession happened right around World War I. That's when we first started to have the draft. And there was actually a national security concern because the oral health of our population was so poor. It shouldn't come as a surprise to dentists because there was about 7% of people that were actually brushing their teeth every day. There was this new company called Pepsodent, and they went to this very famous marketer named Claude Hopkins. He talks a lot about this in his autobiography, and they said, hey, we want you to get people to start to use this product. And he talked about this a lot, and he said, I didn't think there was any way to motivate people to use and buy this product because there was already door-to-door sales and education about toothpaste, and nobody wanted to use it. Very similar to what we have with floss right now. But he didn't give up. He looked through some dental textbooks, and he saw this concept of something called biofilm. And the way he described it was, this was this layer that formed on your teeth that made your teeth off color and invited decay. But what he really was doing was genius, because he came up with a universal cue, because everybody gets biofilm on their teeth. So they exactly knew when to use the product. He also came up with reward. The reward, this is when television first started to come out. He had famous, beautiful celebrities advertise that they wanted the Pepsodent smile. And of course, just like today, people wanted to do what the celebrities wanted to do. They all wanted to have the Pepsodent smile. But what he didn't talk about is what happened after that. Pepsodent became a global product. Everybody wanted to have it. And a lot of people tried to copy off these advertisements. And what they found is they could get people to use the product once, but they quickly switched back to Pepsodent, and they couldn't figure out why. And the answer actually lied in Pepsodent's patents. They were the first company to add citric acid to their toothpaste to give it a fresh-tasting feeling. So what people were not really seeking was the beauty, it was this feeling of fresh breath. It was really the cool, tingling effect that was an irritant that actually had this unanticipated effect to get people to use the product. And just comparing a little bit with what Claude was trying to do and what I'm trying to do. Universal cues. Claude used biofilm. I use after every meal because it's a stronger habit to actually form. Several reasons. One, we all know that's when the acid content is the highest in the mouth. That's when the XERO stick is going to be working the best to promote salivation. Secondly, this is when people are already thinking about freshening their breath. They're already thinking about pulling the cilantro from their meal out of their mouth. And third of all, this isn't something that we need to retrain or re-educate the population about. Every restaurant in the world has toothpicks sitting at their cashiers, and most people overseas have them sitting right on their table. Defined rewards. Claude used beauty. At best, beauty is subjective and a delayed gratification. Fresh breath is here and now, and that's what's motivated people to use products before. And finally, tingling equals working. That's what happens with spilanthes. It works on ion channels, just like the citric acid does in the toothpaste to give that fresh tasting feeling. There's a lot of different benefits for your office. We have individually wrapped, and that's actually, you guys have tubes. Those are sample tubes today. All the XERO sticks are actually going to be individually wrapped. But we also have custom labeled tubes over here. There's 21 sticks in a tube, one for use after every meal for a week. Unlike floss, there's a very unique and viral social component to these. People pass them out like they're candy or gum. And that's why it's very important to do custom labeling on here, because what happens is when people pass that out, it tastes better than what they thought. They want to know where they got it from. And this is really the catalyst for internal marketing for your office. If you want people to refer others to your office, you got to give them a reason to actually bring up the topic of your office. And having something new, especially if people don't like to use floss, is a great way to introduce your office. This also really gets your staff involved in a fun way. If they've done this little pH testing in their mouth, they can actually talk about it with your patients. It gives them something to do. They want something new and fun to talk about too. That way the dentist doesn't have to do anything. The staff is actually going to work for you. We're also taking advantage of impulse buying habits. The number one selling thing at any convenience store, drugstore, grocery store, anywhere in the world is breath freshening products at the checkout counter. People are always thinking about fresh breath, but they're especially thinking about it when they're coming to your office for recommendations. And really, if you think about, I think really, if you're keeping count, there's about 15 advantages over to what traditional floss has already. Some of the most important is really packaging. People like things that are convenient, fun, and easy to use. And if you think about a lot of the paradigm-shifting products over the last decade, a lot of them are things that have made our lives more convenient, fun, and easy. Twitter, a convenient, fun, and easy way to communicate. Netflix, a convenient, fun, and easy way to rent movies. The iPod, a convenient, fun, and easy way to listen to music. The Kaboom Stick, a convenient, fun, and easy way to improve oral health. One of the first people I've ever given a XERO stick to is Steve Rogers. Now he really tells the story of how much dry mouth can really affect your life.
In 2007, unfortunately, I was diagnosed with throat cancer and was immediately started on radiation therapy for 6 weeks. The radiation was so severe it caused very harsh and painful side effects, including burning mouth syndrome, causing my mouth, tongue, and throat to burn like it's on fire 24 hours a day, 7 days a week. The radiation also burned away my taste buds, so I have no taste at all. Just as severe is my dry mouth, where I have very little saliva, which only contributes to my burning mouth. I have to have a bottle of water with me at all times. I was miserable. My radiation oncologist had done his part and could only suggest the usual regimen of prescriptions, the over-the-counter medications for dry mouth, and believe me, I tried them all. I worked with a pain management doctor for the pain. I researched diligently, visited numerous doctors and hospitals, and asked every medical professional I ran into if they had any solutions. Having worked in healthcare most of my career, I have trusted friends in the business who spent a lot of time trying to help me. I even applied for several clinical trials, both here and abroad. In other words, I literally tried everything, no matter how crazy it sounded, and finally came to the conclusion that there wasn't any reliable, lasting product out there that could help me. By pure luck, I was referred to a dentist in Arizona who was infusing an herbal medication into toothpicks that supposedly helped dry mouth. Well, this sounded a bit far-fetched to me, but as I said, I will try anything. I got the mail one day, and there was an envelope with a tube of toothpicks inside. I thought to myself, well, here we go again. But I popped one in my mouth, and almost immediately my salivary glands kicked in, and I had real moisture in my mouth. I was ecstatic. I couldn't remember when I had so much saliva. It was indeed miraculous to me. A secondary benefit was the saliva helped soothe my burning mouth. The product also coated my mouth, helping me swallow. I will never forget that first toothpick. And the medication lasts as long as the toothpick does. But all I can do is tell you my story, and that I truly believe it has changed my life in a very positive manner. I strongly suggest that you at least try it. I'm convinced you will not be sorry. And finally, I would have never gotten through this much talking without this. My toothpick.
Tells a very compelling story about someone who's exhausted literally every option out there up to experimental clinical studies. And he puts the XERO stick in his mouth and he gets instant relief. We're talking about a very far-ranging problem here. It's estimated that 50% of the elderly population, 30% of women, and 20% of the general population has symptoms of dry mouth. And again, that's very underreported because often people have to lose about 50% of their salivary flow before they report that as a chief complaint. And in my mind, these are all dominoes. If we can get someone on the far one side of the spectrum like Steve that no one has been able to help, everything else falls. Medication-induced dry mouth, not that big of a deal to fix. Even if we think about the cavity process, bacteria eat sugar and yields acid, which actually causes cavities. Our approach in dentistry has always been to try to decrease carbohydrate intake. That's a losing battle in a fool's war. We're never really going to affect change that way. And even if we did, all of the diet drinks and the XERO drinks all out there have a pH of 3 or 4. People are drinking acidic drinks all day long. The most direct way to affect the cavity process is to decrease the acid in the mouth. The XERO stick does this by definition, as it promotes salivation, which is going to dilute and neutralize the acid in the mouth. I've spent hundreds of hours talking to thousands of medical professionals, dental professionals, and patients about Kaboom sticks over the last 2 years. And I found some things that are universally true. Physicians get this concept in 2 seconds because they understand the sublingual delivery, and they write these medications that cause dry mouth dozens of times every day. Patients get this concept in 2 seconds because they either don't floss or don't like to floss, but they definitely like things that taste good and they know exactly what to do with the toothpick. As a profession, we've been trying to educate and motivate people into floss use for over 100 years. But unfortunately, it's something that's just really never caught on. And it's not from lack of trying or effort. Generations of dentists have preached floss use at every twist and turn. I want dental professionals to feel as passionate about improving oral health as I do, but we have to understand and accept flossing is not a religion. It is a tool to remove plaque. The Kaboom stick is also a tool to remove plaque, but it offers many other benefits for patients and marketing and social media opportunities for dentists. Amazing things can come in some small packages. The Kaboom stick not only improves oral health, but it's also a tool for change. Thank you for your time.